Mike on the mic from Recovery Systems. With me today, it's my pleasure to introduce Matt Hurd from MyFootDr. G'day, Matt.
G'day, Mike. How you doing, buddy?
I'm good. So Matt and I go back around 10 years. The relationship really started around athletes and everything from the feet up, from a prehab, in other words, seeing things that weren't good and fixing them before they broke, rehab, which was when they did break, and also from a performance point of view, because Matt has a long experience in biomechanics. But today our topic is around lower limb swelling, which is a really big issue in this day and age. And so I wanted to start off by kindly introduce yourself and MyFootDr, Matt, and then let's start the ball rolling on lower limb swelling.
Yeah, okay. So as Mike said, we're a podiatry clinic. We're a little bit different to your typical podiatry clinic. We focus on a lot of, like Mike said as well, prehabilitation, rehabilitation. We look at the causal relationship between your injuries and your body mechanics. So that can involve everything from the pelvis and the hips through to the knee mechanics. I mean, you've got a whole kinetic chain. We don't just look at the foot and ankle. We've been around since 2011. Most of the athletes most of our practitioners in the clinic, we're athletes ourselves. So we've had every injury that most patients have ever come in with. So I guess leading into the topic for today, you were going to talk about peripheral edema.
Yep. Yeah, talking about lower limb swelling, and you know, we as a brand treat swelling, but we're not practitioners. So it's not our call on what caused it and how to treat it specifically related to the medical side. So what do you see from a lower limb swelling? What are some of the common causes that you see?
Well, that's the thing. There's a huge range of causes, and a lot of people aren't really aware of the extent of how many things contribute to what we call peripheral edema or lower limb swelling. So, I mean, edema in the lower limbs, it can result from things ranging from disease processes through to mechanical overload. So in the clinic, we actually see many causations. I mean, one of the common ones we see is pregnant women. You know, 80% of pregnant women develop peripheral edema with their weight gain, their hormonal changes, their decreased level of activity for some. A lot of women also develop preeclampsia. Then you've got, in women in particular, you've got hormonal changes during their menstrual period, which can lead to peripheral swelling. And then you've got things from excessive salt intake for certain groups. Drug reactions are a very common one that people don't really understand. High blood pressure medications, corticosteroids, antidepressants. I mean, these are actually really common. You've got more severe things like blood clots, which is what we call deep vein thrombosis, allergic reactions, malnutrition, believe it or not. So a lack of protein can lead to peripheral edema. Things like arthritis and gout as well. A common injury or common injuries to the knee complex that lead to what we call a Baker's cyst developing. So that's an accumulation of fluid in the back of the knee, and that in particular can cause fluid to accumulate in the lower limb. Obesity, which is very common these days, leads to a decrease in fluid being returned back to the heart. And then you've got disease processes, so heart failure, pericarditis, liver damage, which is really quite common, so cirrhosis or scarring of the liver, lung conditions, so pulmonary hypertension or blood vessel conditions of the lungs. Renal failure is a huge complication that usually arises from diabetes, but it can happen on its own as well. I guess one of the more common ones that you'd be working with is those in the exercise realm. So those triathletes, Ironmen, Ironwomen, post-exercise, post-activity, they develop a lot of swelling. By far the most common we see would be venous insufficiency. So for those that don't understand what that is, it's damage to the veins and the structures inside the veins. So inside the veins, we've got these little valves, and these valves, they stop the backflow of blood. And when they become pressurized for an extended period, they become faulty and break. So you get a backflow of fluid. The blood begins to pool in the lower limb. That leaks into the interstitial tissue. This overpowers the lymph drainage system as well. Another common one, which would be one that a lot of physios would see, would be lymphedema. So our lymph system surrounds our vascular system, so the blood vessels, the arteries, and the veins. And when that doesn't work properly, or when it's damaged, it can't take that fluid, reabsorb it, and push that back into the venous system to return it to the heart. So the lymph system is actually a whole network of vessels and glands throughout our body. They help remove that excess fluid. They help with lymph drainage. So I'd say the most common cause of damage to the lymph system would be from cancer. So they get a lymphadenectomy, so breast cancer, they remove the lymph nodes. An infection, so you get a lot of people that develop infections, or an injury to a particular area is quite common. Even inflammation of a limb or lack of movement can damage the lymph system as well. I mean, that's a pretty extensive list, and I'm pretty sure I haven't addressed all of them there either, I'm pretty sure.
No worries, no worries. That's a big long list. And look, what for our listeners, how typically do those conditions manifest themselves?
So there's a whole range of ways they can manifest. I mean, the first is you notice accumulation of fluid around your foot and ankle.
So shoes are getting really tight, may not fit anymore.
Socks leave compression marks around the ankle. You start noticing that when you push into your foot and ankle, you might end up with some compressions or divots that stay. And that's what we call pitting edema. You might notice you've got more varicosities, or you might notice you're starting to get some brown stains to the skin, or all those little tiny capillaries and veins, the blood vessels, you might notice they start to appear and they're starting to look like they're ballooning and becoming all undulated. Pain is another one. I mean, those that leave it too long, I mean, ulcerations are quite a end stage result of this sort of thing, but you can have a whole string of problems developing from this sort of thing. Hemostasis is what I was talking about before. That's where you get because the blood has been pooling for so long, the iron that is attached to the red blood cell, it actually leaks out and it stains the skin a brown color. Telangiectasia is the one I was talking about before, which is that the blood vessels. Pitting edema is the one where it's been there for so long, the fluid becomes fibrotic. So it actually it leaves impressions from everything you've done to your foot and ankle or lower limb. Worst case, you can get chronic ulcerations, or you've seen some people that develop what we call those champagne-shaped legs, the upside-down champagne leg bottle. And that's because of the atrophy of the muscles and the tissues and the skin around the foot and the ankle. They're no longer there. So that's a range of things that can present, but typically it is just inflammation and swelling and the accumulation of fluid. That's the thing that people first notice. Yeah.
Well, let's get on to discussing treatment. Let's talk about intermittent compression, which was where our technology begun. Of course, we crossed over into other things, into athlete, because of the exercise-related edema as well. And then we're moving into even animal, specifically equine, because they're athletes with 4 legs, basically. But let's come back to the sole reason intermittent compression was invented around about 30 years ago. And do you want me to go through some modalities from our point of view?
Yeah, you can definitely explain to people your system, because you've got the 2 different options on your machines that we use.
Yeah, we do. So it's not up to us as a brand owner to make a call on the condition. That's definitely your domain as a practitioner. But how we work with MyFootDr and other practitioners around Southeast Asia, would be, we have a range of products. They're boots. Essentially, I'll describe them as boots that expand and contract. Now, they squeeze and release. So the pressure is variable and can be adjusted. And we have a couple of different treatment modes. But before I get on to those, there is a good reason why they expand. In other words, they squeeze the lower limb to move the blood volume up and then release. So the release phase is just as important as the squeeze phase. So for example, rather than a compression sock, which is static and is only squeezing but not releasing, there's some real goodness to the squeeze and release phase, because you're moving essentially I describe it as moving the bad stuff out and bringing the good stuff back to speed up healing, recovery, and gains. And so we've had experience across a whole range of conditions, not our place to call, but working with Matt, most recently with DVT, diabetes, lymphedema. The conditions may vary, but there's always swelling involved. And pleased to see we've had some very good results on treating the condition. Many people experiencing a return to a better quality of life. And a better quality of life is that's a very relative thing. For some people, that means they're able to walk again. For other people who may be a lot more agile, they may be returning to sport or competitive sport again. So just to go very quickly into treatment modalities, because we have two. There are two scientifically proven ways of treating lower limb swelling. One is a method called peristalsis, or peristaltic, and that's where you're squeezing one zone at a time. So typically a cuff is split into different zones. It might be 4, it might be 6, it can be as many as 12. We've found that 4 to 6 is very effective, and it will squeeze the furthest most zone first and then release, then move to the second zone, then release the third zone, and so on. So that's peristaltic. The other methodology is sequential. So sequential is starting from the bottom and squeezing in a sequence all the way to the top of the cuff. And generally cuffs either come just above the knee or all the way up to the upper thigh. So they're moving the blood volume through the lymphatic area to do the extraction. And there's different functionality involved. Some of them are battery powered, some of them are much more portable, some can be used on aeroplanes, and so on. So Matt, I'm going to turn it back to you on treatment protocols, knowing that our machines start off at 0 pressure and can go up to 240, which is a lot, which would be appropriate for an athlete. We're talking mmHg units of pressure. Let's start to back and forward on treatment modalities, your preference, peristaltic versus sequential, and the sort of pressure that you'd be prescribing for different situations.
For different scenarios, different people. So the difference between using your static compression socks through to your pneumatic compression is that your static compression sock is not going to help move that fluid out of the way. It's not going to help return that fluid back. So we use the static compression socks to help prevent the accumulation of fluid. But even then, they're still not as good as a pneumatic compression machine. You still need to get that fluid milked out of there at some point. So a combination of both works well. And that combined with treating the underlying cause is obviously essential. So we combine treating the underlying cause, exercise therapy, and that can be anything from just simple cycling, walking, moving, getting the calf muscle pumping, so it's squeezing on the blood vessels, getting the thighs and hamstrings moving, through to pneumatic compression. Now, for the pneumatic compression, it really does depend on the individual. If you've got someone that's got a combination of peripheral vascular disease with venous insufficiency, then you're going to be using a much lower level of compression therapy as opposed to your high-end athlete.
Yeah.
So it's very difficult to give ranges. In general, I'd say athletes would be the 180 and above, 160, 180 and above. But for our diseased people suffering from a disease process, they'd be on the lower end. You know, we might start them on 60 to 80
Yes.
and build them up to maybe 120 would be an adequate range. But when it comes to the difference between the two options, we actually use a mixture of both because they both got their positive points. The important thing is to try and get that fluid and try and milk it out of there and get it moving, and both do that quite well. So with the sequential and the peristaltic sort of motions, if you can get that pumped out, use a mixture of them, I actually find a combination works better than picking one over the other. So I don't really have a preference. I personally get patients using both. The benefits of what you're after, and that would be to, first of all, get the fluid out of there, but you're going to accelerate the body's healing. You're going to assist with recovery. You're getting rid of those metabolic wastes and the inflammatory mediators. You're decreasing inflammation. And you're going to speed the delivery of nutrients. Repair is going to be improved by doing all of that. And that's more, we're after that end result. So for us, the choice of modality is not as important.
Okay, that's cool. So some of our experiences with, say, lymphedema, where we've had extreme swelling, we've found that even 20 mmHg of pressure for some people is all they can handle, and it does the job because they've got extreme swelling. Everything is extremely tender. So why so low? And why does it work? And the magic is that we're moving the liquid out, and
Exactly. It actually doesn't take that much.
Yeah. The other thing we found, some people are a once a day treatment protocol. Some people, based on the level of swelling, and you know, people will. There's a whole lot of varying responses. Of course, there's no a rule book on how quickly people will respond. Human body being very complex. We've got some folks that are using our product 3 or 4 times a day. Some of those people are athletes. Some of them do have advanced swelling, and I also had some reports from some customers who were delighted with the progress, but they reported back to me that if they had a day that they had more exercise than normal, quite typically the next day they had to add one more treatment onto the protocol in order for the body to keep up, because we're really helping bodies to keep up, bodies that aren't functioning as well as they could be, to keep up with the elimination of the fluid.
I'd say especially for your endurance athletes, your Ironman, your Ironwomen, your triathletes, long distance runners, they're the ones that need to add the extra session or two in to keep up with the muscle recovery, the fluid retention, the metabolic waste products that are building up, and the delivery of nutrients back into the tissues as well. So just pumping that fresh blood in, getting rid of that static lymph that's built up. So especially a triathlete or Ironman that might be doing 2 sessions a day, it's very important for them.
Yeah.
So, and that's where it depends on the individual. If you're just training once a day, and CrossFitters are a group that I don't think are utilizing this as much as they should or could, especially with the level of training that some CrossFitters are doing, and the number of segments they're using, the sort of functional movement patterns that their bodies are being subject to, Olympic lifting, heavy deadlifts, massive squats. You know, when you're putting 100+ kilograms over your head, you're using every muscle from your foot and ankle through to your wrist, and they need to be trying to work on their recovery side of things more so than they are. I guess a lot of people don't understand most of the gains are actually made outside of the training environment. not
Yeah.
during that 1 or 2 hours that you're training. It's your nutrition and your recovery and your rest that's actually the most important part to boost your gains. And that's where, if you look at the top athletes, they're doing everything from breathing techniques to meditation to pneumatic compression to sauna therapies to infrared therapies to you name it.
Pneumatic
really,
compression.
To dial in on their recovery, because that's vital. And unfortunately, I think that's one group that could benefit from this in particular.
Yeah, well, there's a saying that goes, and as a coach with 10 years of coaching and as an athlete like yourself, the training makes you worse, recovery makes you better. You only get the gains once the super compensation happens. And with regular use of pneumatic compression, what you're doing is speeding up the elimination and bringing, like you said, the fresh nutrients back to speed up the healing, recovery, and gains. So one thing that's really helped us to validate this is, there's a couple of things, in fact. One is a very simple thing. People fall asleep when they're doing a recovery session on our boots. And the reason why is their parasympathetic system has kicked in and switched on. In other words, the body's hit the healing switch. And a classic sign is people have fallen asleep, because we know that sleep and rest is the ultimate. And we've actually promoted, along with the blood flow of the squeeze and release, we've promoted the body going into a parasympathetic state.
Well, that's the other part of the recovery process, that people just think of pneumatic compression as only helping to move blood flow around, but it's doing a lot more than that. It's helping to glide the fascial layers. And those fascial layers, it's not just your muscle and the surrounding fascia that connects to the tendons and that connects to bone or ligaments. It's actually your neural structures as well. Your neural structures are surrounded by a sheath, and our nervous system actually cops a huge beating during the training that we put our body through. And the pneumatic compression actually helps with the healing of those neural structures. It helps to get rid of, it helps to glide and get that nerve functioning better. If you've got a better functioning nervous system, you've got better neural activation, you've got better muscle recovery, you've got better proprioception. It's got a whole host of benefits that aren't talked about.
Yeah. Well, we weren't able to validate this with data until fairly recently. With the onset of such devices as near infrared light spectrum muscle oxygen sensors, these have been a great way of us validating what actually happens during a 30-minute recovery systems treatment. And typically we're finding an increase in muscle oxygen up to 30%. And the very interesting thing is that the biggest part of that 30% happens in the first 10 minutes, and then it's kind of increments beyond that. It's a smaller incline after that. And so we've actually developed a recovery systems protocol for warm-up, because we can bring in 8 to 10 minutes, we can bring someone's muscle oxygen above what it would normally take them 30 minutes doing a warm-up. Now, we're not saying don't do the biomechanical part, because you do need to do that. But from a vascular point of view, you're quickly priming the vascular system so it's ready for business. Still need to do some biomechanics, but there's a bit of a warm-up hack for most of us that are time poor.
So that's one of the things we promote for the athletes that we actually see. I'm going to take out the time poor part, because we advocate, especially for people that are sort of in a certain age bracket. And if you're over 30, your injury risk is amplified to a huge degree. So when it comes to me personally now, my warm-up routine is a minimum of 30 minutes to an hour before I do any sort of Olympic weightlifting or any sort of CrossFit or any even going for a run. And part of that is actually using the pneumatic compression, which is your system, the recovery system. So our recommended protocol is actually to pneumatic compression of the particular limb that's going to need biasing, combined with the necessary mobility and trigger pointing, stretching, but also with the pre-activation of certain muscle groups. So for example, a deadlift or Olympic lifting session, we get them to go through and use it on their limbs, combined with a pre-activation of hamstrings, glutes, just getting those muscle groups primed. And you'll find that the performance, the recovery, their ability to lift, I mean, you get people that are making lifts that they typically wouldn't in the Olympic lifting athletes. And that's an area that, once again, is underutilized by a lot of athletes around the world.
Yeah, well, we really listened to that group, and recently, we're about to release. We've just given the tick on the protocol. On the prototype. Up until now, we've had leg cuffs, and we've had a separate cuff that targets the hip and glute area, hip, glute, groin. So we're now rolling that cuff on one of our models into one cuff. So it's from the foot right up to the waist, because we realize that people are time poor. They won't necessarily be so disciplined to use two cuffs. So we really looked at and designed over a period of time an all-in-one, so that people can hit not only the peripheral but also the power muscles. And that's coming out in about 1 month, in the month of May or early June, and that will be on our battery model. So the battery model being just usable anywhere, the corner of the gym somewhere, in the car, provided somebody else is driving, on the airplane, or on the balcony at home, down by the pool side. So we thought about that, and that was based on exactly the feedback that you're talking about, where the proper warm-up techniques were kind of being ignored, and it ends up being an injury. Nobody's happy with that. So that's right. That's great to have your feedback, and we've listened to you on that, Matt. So we've really valued your inputs in bringing that further development together. So we've discussed it. We've discussed a lot today, and I should also mention we've got arms and torso available. So we basically cover all the body parts. But we always recommend people start with the legs, or the legs through to the waist first. That's a pretty important area because it's involving the lymphatic system. But we've got a lot of paddlers, CrossFitters, Spartan racers, mixed martial artists using the arms as well, because they're very arm intensive. Yeah. It's been really great catching up with you, Matt.
No, thanks for having me on.